everybody. How do zoos prepare a baby gorilla for a lifetime of medical care without fear, force, or stress? It starts much earlier than most people realize, and it begins with something as simple as a bottle. This video shows one of Jameela's earliest training sessions, captured indoors at the Cleveland Metroparks Zoo a few months ago. At this point, she was not yet 2 years old, and this session wasn't about performing tasks or following instructions. It was about learning to trust. For the first part of the session, you'll notice the keeper isn't asking Jameela to do anything at all. She's being calmly bottle-fed while the same keeper simultaneously spoon-feeds Freddy her flaxmeal cereal. This quiet moment is intentional. Training for gorillas is entirely voluntary. Nothing is forced. There's no restraint, no pressure, and no expectations at this stage. Jameela is simply learning that training sessions are calm, predictable, and positive experiences. Once Freddy finishes eating, the keeper gently shifts his focus to Jameela. He begins by softly touching her hands and feet, not asking her to move yet, not expecting her to respond, simply helping her grow comfortable with being handled and hearing verbal cues, even though we can't ourselves hear them. This is the very first step. Before a gorilla can learn where to place her hands or feet, she must first learn that human touch is safe and predictable. As Jameela grows older, this groundwork will allow keepers to teach her something more specific: how to place her hands and feet in designated spots on the mesh, guided by the keeper's own hand. Eventually, she'll learn to turn around and present her shoulder for injections and blood draws, all voluntarily. Voluntary training is one of the most important tools modern zoos use to care for great apes. By teaching gorillas to willingly participate in their own health care, keepers help them remain relaxed during exams and procedures. When gorillas cooperate by choice, especially when rewarded with treats, medical care becomes safer for both the animals and the people who care for them. Without this kind of training, gorillas would need to be anesthetized for routine procedures, which always carries risk. That's why this training starts so young. To see where training sessions lead, we can look at Kunda, who's a bit older in this clip. She's already responding confidently to cues and placing herself exactly where the keeper asks. This is what patience, consistency, and trust looks like over time. And here's Kayambe, even older, calmly turning around to present his shoulder. This is the end goal of cooperative care, a gorilla who understands what's being asked and participates willingly. Now let's go back and see how the training session with Jameela ended. As the training session wound down, Kayambe joined his mom and sister, happily grabbing a few leftover snacks, a reminder that even serious training sessions can be positive and rewarding experiences. This may look like a quiet moment in gorilla life, but it represents something much bigger. This is how zoos prepare baby gorillas for a lifetime of care, starting with trust, patience, and choice. It all begins with moments just like this. Before we go, we'd like to thank everyone who watches our videos, leaves comments, and most importantly, supports us via PayPal and Super Thanks. Your support allows us to share more stories of animals from around the world. If you enjoyed today's video, be sure to like and subscribe for more sweet animal adventures. We'll see you next time.